Hello and welcome to our tutorial on iron deficiency anemia, specifically the pathophysiology. Simply, we need iron in order to make hemoglobin, which is carried on our red blood cells. Because hemoglobin is the transport molecule for oxygen, and here's our hemoglobin carrying oxygen to our tissues. Iron is essentially a fuel for red blood cell production because it's such an essential piece of the hemoglobin. So we get iron, it's put into the baby red blood cells or proerythroblasts so that they can grow and become adult, healthy red blood cells that can carry enough oxygen to all of our tissues. Iron is stored in various places in the body as the molecule ferritin, and it's stored in the bones, the liver, and muscles throughout the body. Iron is absorbed in the proximal small intestine, which is why certain individuals with gastrointestinal disorders or history of surgery are at risk for iron deficiency anemia. So when there's a problem getting enough iron, or you need more iron than normal, and or you're losing blood for some reason, you can't replace the iron, you have red blood cells that just grow up and they're weird. So they are microcytic or smaller and hypochromic, and that is checked on a simple CBC that can just look at the shape and size of the red blood cells and also their coloring. So as previously discussed, iron is stored as ferritin, and the major transport molecule is called transferrin. Essentially what this does is it picks up the iron, abbreviated Fe, and finds a receptor, a transferrin receptor, and then it gets into the cells, erythroid cells, in the bone marrow. And then it can make these healthy adult red blood cells that we love to see in the system and can do what they need to do. So intuitively, there are 3 stages. The first one we're going to see is decreased storage of iron in the liver through depletion of ferritin, in the muscles and bones as well. So that starts to go down, and then at the more cellular level, the baby red blood cells simply cannot get enough iron to become healthy adults, so we get something called iron deficient erythropoiesis. So they start to grow up a little odd and not fully functioning. And then the third stage, we get full-blown iron deficiency anemia, where the red blood cells are microcytic and hypochromic, or too small, not very red, not very red in color. In this situation, it's important to think about what's going on. Why aren't they getting enough iron? First, decreased absorption can be a result of history of gastric bypass surgery or other GI surgeries in the past that interfered with the proximal loop of the small intestine, Crohn's disease, celiac disease, any type of digestive disorder that might, the lining of the intestines is inflamed and iron just isn't getting in or absorbed. Of course, decreased intake can contribute, and this can occur in elderly people, strict vegetarians, and also people in poverty, since meat is one of the richest sources of iron in our diet, and they simply can't afford it. Of course, people who are pregnant or breastfeeding have higher iron needs, so they need more blood. So here is our pregnant belly. So people are in this situation, women are usually on supplementation. And of course, children that are growing need more iron. So they might go through a growth spurt and simply not be able to make up for the amount of iron that their body needs. And of course, decreased blood in our system. Bleeding can happen anywhere in the body, and we just can't make enough. We don't have enough iron to make enough for our blood cells to keep up with the blood loss. So GI tract bleeding is common. Obviously, when bleeding is more obvious from other sites, we can fix it easier. But in the GI tract, we test for something called stool for occult blood, or STOB. We also do scopes, so colonoscopies or endoscopies, to see where the bleeding is coming from and take care of it. Women, this is a uterus. Women with heavy menstrual periods are at higher risk for iron deficiency anemia simply because of the blood loss from that part of the body. That is a brief overview of the pathophysiology of iron deficiency anemia. I hope you enjoyed this tutorial.